And to pivot a bit, you're also giving a presentation on multisystem inflammatory syndrome in children. Can you take me through this presentation?
Sure. I mean, David McLean had asked me to speak on what's new in pediatric rheumatology, and certainly MISC is new, and so that will be a large chunk of that talk. And it's really it's always a tall order to kind of summarize what's new in any field, particularly something as broad as pediatric rheumatology. So I kind of focused much of the talk on stuff that's tangentially related to MISC, including just a lot of new things we've learned about systemic juvenile idiopathic arthritis and a subset of children who develop a severe lung disease, often with a cytokine storm or macrophage activation syndrome. Some new biomarkers we're using, including ADA2 or adenosine deaminase 2 and interleukin 18. Some of the data published on treating cytokine storm syndromes or MAS with things like anakinra, for example, which is an IL-1 receptor antagonist, or emapalumab, which is a monoclonal antibody to interferon gamma. And then really ending the talk with MISC or PMIS or whatever acronym you want to give this new entity that seems to be a post-infectious process from COVID-19 that children seem to be at higher risk for, certainly than adults. And it shares in many of these patients features of Kawasaki disease, including coronary artery changes in a small subset. But many of them present more with a shock-like picture if they're sick enough to be hospitalized without much pulmonary involvement, like the adult COVID-19, for example, or even children who get COVID-19 pneumonia. They have more of a gastrointestinal illness and present with shock, but fortunately most of them do pretty well, again with features of a cytokine storm in many of them, to the point that in addition to just treating the shock in general, as you would in the intensive care unit, for example, treating the hyperinflammation, whether it be glucocorticoids, many also will receive intravenous immunoglobulin because of some of the shared features with Kawasaki and the potential to prevent coronary aneurysms, for example. So I don't know who would have predicted MISC or PMIS or PIMS or whatever you want to call it. I certainly didn't predict it, but it's a fascinating new entity, unfortunately, for pediatric rheumatologists and others.